Vestibular syndrome refers to a disease group that affects the vestibular system, which affects the balance system. This disease can be caused by many things like nerve or brain tumours, infection, inflammation, an underactive thyroid gland, or it may be that even with exhaustive investigations, no cause is found. When no cause is found, this is called idiopathic vestibular syndrome. Vestibular syndrome can occur in dogs and cats, and the common signs are loss of balance, falling over, flickering of the eyes, and they're generally unsteady on their feet. Vestibular syndrome can be very upsetting for the pet and the owners, but it's usually something that will get better over time. The vestibular system controls balance in pets and keeps them balanced in different situations. The vestibular system has sensors deep in the inner ear and control centre of the back of the brain. These sensors ensure the body and position of the head are in the right place, whether they are standing or moving, by sending messages to the brain and other parts of the body. Messages are also sent to muscles controlling the movement in the eyes according to where the head is positioned. The signs of vestibular syndrome are the same in dogs and cats and include falling, tilting of the head with one ear lower than the other, a rapid flickering of the eyes from side to side or up and down. They'll not be able to walk in a straight line, or they'll drift to one side and they'll act in an abnormal manner. The balance centre is also close to the part of the brain that controls vomiting, so they may feel or be sick. They may also have hearing loss and their face may be drooping. Other signs may be seizures, weakness, loss of vision, and difficulty eating and drinking. If you suspect your pet has this, you'll need to go to the vet as soon as possible, and they'll look at what tests and treatments are necessary, or they may not give any treatment. They may need to carry out a CT or MRI brain scan, or carry out other further investigations, including taking a sample of the fluid around the brain and the spinal cord. Drugs will vary and may include antibiotics, steroids, anti-nausea drugs, all depending on how the animal is affected. Depending on the underlying cause, the prognosis will vary. Some animals are left with a permanent head tilt and others may need treatment to make a full recovery. The cause may be an ongoing condition that needs treatment, but this will vary depending on the individual animal.